So I hope you enjoy my last session for the what I can say boring PowerPoint presentation. Now let's talk about the on face like live session of the Facebook. I talked about the all the issues with the soft tissues. Now there are numbers of reasons for you people why we need to mobilize soft tissue, because restricted range of motion can create some issues on nerves. It will can create the issues on the muscle contraction. It will create the issue for muscle lengthening and shortening. So don't forget to mobilize the soft tissue. For mobilization of soft tissue, it doesn't include only a simple mobilization of skin. It doesn't include a simple mobilization of fascia. It doesn't include a simple mobilization of your muscle. It will include all the process. Like if I'm talking about the mechanoreceptors of your skin, then mechanoreceptors can feel the stress in your body. We have 4 mechanoreceptors in your body, basically 4. In that, first one is your Merkel disc, Biceps corpuscle, and you have your Ruffinian links and Pacinian corpuscles. See, these all 4 receptors can work on your skin. If you're going to rub your skin, it means you're going to stimulate these receptors. So for the mobilization of soft tissue, it's not just try to stretch the muscle, it's not try to mobilize the muscle. Sometimes if you want to release the muscle spasm, then also you need to work on the receptors, because receptors can feel the everything, and receptors can send the signals to your brain, and it will help to reduce your spasm and sympathetic activity. If I'm talking about the Ruffinian link, then if you're going to apply a lateral stretch on the skin, it will try to stimulate your Ruffinian links, and that Ruffinian link stimulation of Ruffinian link will give the signals to your brain, and your brain going to be reply with the inhibition of sympathetic activity. So Ruffinian link stimulation will help you to inhibition of sympathetic activity. So there are multiple use of different receptors that you can approach during the soft tissue mobilization. So remember one thing, soft tissue mobilize just not to stretch and what I can say, just try to pull up the muscle. It's about to activate or stimulate your mechanoreceptors. So you hold the game, you'll include it on your mechanoreceptors. All right. So you can use your hands, you can use your fingers, you can use your forearms, you can use other tool, you can use your cups, you can use ISCM tool, you can use your active release technique. In that you can use a tennis ball, you can use a golf ball. It's up to you. You can use anything for release, but make sure you need to find out the depth of scar. It's a main aspect. You need to find out the what I can say restricted areas. Then only you can approach. See, if I'm talking about the headache, since numbers of time I'm seeing that the person having a tight trapezius muscle, it will give the pain to the headache. So person can feel the headache because of that tight trapezius. So we need to release the trapezius. Don't just try to focus on the pain area. Just try to find out the root cause, a cause of the pain. So in the numbers of time, you can see these IT band friction syndrome patient. All the physios who don't have knowledge regarding the origin of issues with the IT band, they just try to work on IT band. But there is a role of glute max and TFL in the tightness of IT band. So just try to find out the root cause and you can mobilize it. See, the mobilization of soft tissue, it's very necessary, because one question for you all, and my fellow colleagues also going to be explain about the manipulations. So for the manipulation, one question for you all and my fellow colleagues also, I hope they will explain you why we just try to focus only on a bone mobilization, like joint mobilization. Numbers of I've seen that person having a issue with the neck pain and just they go for thrust and go for joint mobilization technique. Question for you people and question for all physios: bone will move alone? It's not going to move alone. We need to start the work from muscle. If the muscle contraction is there, then only bone will move, because bone is kind of rigid structures. If you want to move the bone, it means you need to have a contraction in your muscle. Then only you can move the bone. So those who learn this high velocity thrust technique and manual therapy techniques, don't forget to work on your muscle. Otherwise, on every alternate day or maybe on every week, you need to do the manipulation with your bones and joints. See, the manipulation and bones and joints, I don't know about the actual procedures, but what I can say, what are the malalignments in the joints? It's because of soft tissue. Bones not going to move easily. It's going to move because of some contraction created by the surrounding muscle, attached muscle on the bone. That's why it's going to be in this place, and you can say is a malalignment. So whenever you want to correct any malalignment, don't just focus on the malalignment. Just try to find out the cause why this joint going to be malaligned. Maybe surrounding structures trying to pull it up, pull it down. This is the proper rehabilitation protocol. No just only single any thrust or any joint mobilization will work for release. You need to release soft tissue for the proper range of motion. This is the things I want to share with you. How do we mobilize the soft tissue in the patient who are having the burns? Yes, in the burns, later on when the scar formation is there, then you have a multiple technique that you can use. And for that, I love the concept of Syriac that you can use to mobilize the scar, which was formed by the burn skin that you can use. And other scar, don't just try to focus on the incision scar. We have internal scar also that we need to mobilize. Don't just go for stretching for release of internal scar. Try to release with your hands, try to release with your instrument and all that. And I so many times seen the people who just trying to mobilize the superficial structures, but is when the person having an issue with the, let's take example of my wrist. I having an issue with the wrist extension and flexion, right? So do you feel only single muscle will work for my extension and flexion? No. Multiple muscles are working for my flexion and extension. So I need to work on a multiple muscle. And few muscles are on layer wise. You can see this layer 1, layer 2, layer 3. So you need to release this all layer 1, 2, and 3 muscle, because all are going to be create some impact on your range of motion. So don't forget to create some space between the layer of muscle. What I learned in Brazil, the people trying to create some space and trying to mobilize the underneath structures also, because what I seen in frozen shoulder patient, which is trying to work for shoulder flexion, shoulder abduction, and extension, will get the proper range of motion. But when we are talking about the internal and the external rotation, then we're facing issue. And especially with the internal rotation, it's very tough to get the full range of motion in internal rotation. For that process, I want to go and try to mobilize all the structures. Like for internal rotation, I can go and reach up to the subscapularis and try to release it. Same time, if you are talking about the other joints, like your knee joint, hamstring, and like if the person having an issue with the last degree of knee extension, then we always try to focus on the release of hamstring and also working on the, what I can say, quadriceps strengthening. But the tight gastrocnemius muscle also playing a major role for the last degree of knee extension, that we sometimes we forget about this. And same time, when I'm focusing on the supination and pronation of my hand, that time I also forget that my tight biceps also going to be restrict my proper supination and pronation. As we know, the bicep is a strong supinature when I'm in a flex position. So just try to go and find out the soft tissue issues and try to mobilize it. These things will create some new vision for you people. We already learned in the first year about the soft tissue manipulation and mobilization, but we left in first years. So many times I visited in the in conference, and lastly I visited one alumni meet. That time so many students are talking about the massage therapists. We are not a massage therapist. They are become angry when somebody calling massage therapist. See, massage therapist, no, we are physiotherapists. You can fight with this, but massage therapy, it's good. Massage therapy is good, but you need to use on a scientific way. You need to use on a therapeutic way. Then it will be very beneficial. See, massage is not only just rolling the skin. See, when you're going to roll the skin, also you're going to stimulate your receptors, and it will impact on your muscle spasm and muscle activation and muscle inhibition. So don't just try to hate the massage therapy. You can use the massage therapy in your therapeutic way. There's a message for you people. Try to use massage therapy in your therapeutic protocol or rehabilitation protocol. Right. This is the reason why I'm talking about the soft tissue mobilization. I'm very thankful to Dr. Murgil and the HCAP and all the team of HCAP and the what I can say students wings of HCAP. How we decide hot or cold in a subacute soft tissue injury. Okay, how we decide in subacute soft tissue injury. So in subacute stage, you can go with the cold, but not in acute stage. I have numbers of questions there. Okay, when we start the mobilize the tissues and which stage? Okay, for that answer, I can say you can mobilize the soft tissue from stage 2. You can, yeah, it means after the 72 hours, you can start it, no problem. But you need to make sure about the force which are going to apply. So we have screenshot over question. Okay, good morning. Explain about the police therapy in ankle sprain. Yeah, it's a good protocol. Somebody remind me of the police protocol. In present physiotherapy era, we just try to work on a police protocol. Police means prevention, optimum load, and what I can say, previously we just try to focus on a price protocol. In that, we just trying to give some restricts, what I can say, trying to restrict the range of motion and give the rest and everything. But in police, you can give the optimum load, which will prevent your soft tissue adhesion. It's a good protocol that can use. You can give some optimum load to your muscle. See the optimum load. I'm talking about the optimum load. If I'm talking about the shoulder muscle, then till the 90 degree, there is no issue with this your supraspinatus muscle. If you having some issue in the supraspinatus, don't just try to keep in the slings, arm slings. Just try to do some movement until the 90 degree, because above 90 degree you can create some issues with supraspinatus, but till that, no. That's why you can use it. Who have release fascia also? Who we have release fascia also? Oh, no. In this session, I'm not going to explain about the fascia release. Can we apply the ice when the inflammation stage condition is into chronic stage? Or in chronic stage, I'm not going to allow you. I'm not going to suggest you for the chronic what again ice application in chronic stage. It's applicable for subacute, not in acute also. Importance of scar tissue mobilize the patient with the contracture itself of fibrotic structures. So don't allow the patient soft tissue to be on a contracture stage. In the contracture, we cannot release. In the tightness, we can do soft tissue mobilization. In which grade we have started soft tissue mobilization? In tightness, you can. In which grade you can start soft tissue mobilization? On what I can say, on any stage you can start your soft tissue mobilization. Which stage is most crucial? Stage number 2, after 72 hours to the 1 week is very crucial. If you are going to miss this period, it means this condition becomes stiff. If let me share my experience when I start my practice, and we have issue with the range of motion in the patient in the total knee replacement. It's a very good like things to be shared with you. In the total knee replacement patient, when patient was operated, take example, 2-day morning patient was operated, and patient need to go to visit the orthopedic surgeon after 14 days to remove the stitches. Until that time, I'm not allowed to touch the patient. I'm talking about the time of 2008 and 2009. I'm talking about Gujarat. I don't know about the other state, but in Gujarat, they are not allowing us to do some exercises and do some movements. Later on, they feel, oh, now need to give some early soft tissue mobilization to get the proper range of motion. Because already after 14 days, if I'm going to visit the patient, and after 14 days, I'm going to just start simply isometric and ankle toe, and later on, maybe patient having any strength, then I'm going to for SLR. See, I'm just wasting up the time. Like 1 month, I'm wasting after the surgery. After the 1 month, if I'm focusing on the full range of motion, it's not possible. That's why to improve the range of motion, all the orthopedic surgeons now suggesting everyone to go for early joint mobilization. That's why you are lucky that you are on the same day. I can say if the person was operated 2-day morning, then in the evening you are they are inviting, and you can start the TCAR exercises. See, these things are good. Can some types of electrical stimulants help better MFR? Yeah, it's gonna help. how we mobilize the stiff tissue. Yeah, that's a main problem. Why you allowing the tissue to become stiff? Tissue why becomes stiff? Because it's going to be stuck inside. So you need to mobilize it and you can release it. Everything going to be stuck inside. Try to mobilize and release it. In the post-surgical elbow stiffness, how much time we get the results? In a post-surgical elbow stiffness, issue was created by the myositis ossification, then it's difficult. Otherwise, you can work everywhere. Okay. What happened to tendon when it's inflammatory disease like a recurrent shunt in the chronic stage? Yeah. For tendon, I can say for chronic tendinitis, I can say it's not tendinitis, but you can call it a tendinopathy. When the tendon going to be in stage of degeneration, that time with mobilization, if I'm talking about the ISTM, we have a different protocol for chronic tendinitis. We just try to create some microtrauma on the side of tendon and try to again reintroduce the inflammation on that side. And you can work, you can count as a acute inflammation, which will going to be easy heal up. So it's the actual procedure if you are not going to treat any chronic tendon. But meanwhile, don't try to forget the release of associate muscle. If I'm talking about the Achilles tendinitis, just don't work only Achilles tendon, also try to release your gastrocnemius in all the muscles. Is massage is good for soft tissue damage? Yeah, massage is good. How to create space between the layers of soft tissue with immobilization? Yeah, in a different techniques, you can use your hand, you can use a different instrument to create space between the two muscle layers. If I'm talking about the pectorals, like pectorals major and minor, then also I can put my hands and I can create some space between that. Similar fashion, if I'm talking about my sternocleidomastoid, it's literally tight, so I can put my fingers over there and try to roll my finger over there and try to create some space between like this. That you can do. It's a methods of soft tissue release. Yeah, is there a difference between MFR and massage? Yeah, massage only they just try to give some relaxation. MFR is different. Myofascial release is different and massage is different. How early we can start using the STM technique after the injury? After 72 hours, you can start. When there is stiffness in soft tissue, the myositis oxygen should be. Myositis, it's very difficult to treat. Don't just try. What I learned in my undergraduate study, the 5 signs of that we need to avoid in myositis, like thrust, heat, early mobilization, and these things we need to avoid it. Distal fractures, humerus case, how long it will take to be complete elbow flexion? See, any fracture, it's going to be take 21 days to heal up, but you are asking for range of motion. It's because it's restricted because of your surrounding soft tissues, maybe fascia, maybe muscles, or maybe tight ligaments and structures, all that. So we need to release these structures to get the proper range of motion. Impedance to STM for frozen shoulder patient, yeah, you can use it. Oh, I have so many questions. That's good. Later on, I will give the answers. How long we can use the electrical stimulation for paraplegic patient? I'm not a person of neurology, but what I can say for electrical stimulation for paraplegia, what I learned in my PG, my postgraduate studies, if you're going to stimulate the muscle on a higher level, means it will create some fatigue. And every day, if you're going to stimulate, so later on, the muscle plasticity will develop. The muscle will not going to respond. So don't just try to give them what I can say higher stimulation to get the muscle contractions. We can we use STM trigger fingers? Yeah, you can use in trigger fingers. Soft tissue mobilization help tennis elbow for not? Yeah, you can use for tennis elbow. I mean, for soft tissue, yeah, you can use it. How we can be soft tissue mobilization help in degenerative condition? Yeah, in degenerative condition, I'm talking about the soft tissue. It means if there is an issue with the tendon, then you can use it. Can we give the massage on an elbow? I mean, in head massage. Oh, you can. Yeah, you can. So how we can distinguish between contrast math and cryotherapy? It's not a topic to answer in this. Tennis elbow patient apply soft tissue. You can apply the soft tissue. Yeah. So explain MFR insert in the part. MFR myofascial release. Myofascial release and soft tissue release things are same. When I'm going to release any structures like a soft tissue, you can call as a myofascial release. After soft tissue mobilization, what the role of stretching and it's compulsory to do? Yeah, okay. After the release, you need to give some stretching because you just try to release soft tissue. Later on, you just try to focus on a flexibility. For the reason of flexibility, you need to go for stretching. but it should be a slow stretching. After that, you feel all the structures are released, then you can go for other techniques of stretching. But initial stretch, no forceful stretch, because if you're going for the forceful stretch, then patient going to be hurt. When you're giving pain to your muscle response is going to be contractions. So message for you people, don't try to hurt your patient. When if you're going to hurt your patient, it means muscle will be in the contractions. Just try to follow the what I can say goal, like painless physiotherapy. Can we apply MFR? Yeah, can apply MFR. No problem with this. See, I have multiple questions. I will answer all the questions later on after the finishing this session. I'm going to finish my session within 5 minutes. So I'm just trying to revise everything and give some take-home message. Don't just try to treat simple tendon in the patient of tendinitis. You need to work on tendon. Also, you need to work on the associate muscle. Like if you are treating the patient of tennis elbow, don't just try to treat your what I can say tendons of extensors. Also try to release your whole extensor muscle belly. And one message for you, don't give pain to your patient, because if you are treating the patient with the frozen shoulder, their range of motion is restricted, and you're going for vigorous stretching technique, like a patient says, no, it's enough for me, and still you're going for forceful range of motion. It means you're giving pain to your soft tissue, and response of your soft tissue in reply your pain is going to be shortened stage. Already there is a muscle spasm and you're going to increase the muscle spasm. That's why I'm not suggesting this. So one message, don't try to hurt your patient. It will going to be ease up very easily. Okay, soft tissue mobilization technique, the word is a soft tissue. It means you need to go in a soft way. Don't be hurry, don't be just go on force and try to mobilize all the soft tissue on the same time. Don't go for what I can say high intensity stretching. Just go on relaxed way. Your microreceptors plays a role on a high level. If I'm talking about simple, your TENS, if you're applying TENS, you can see it's good. You can see the good results in a control of the pain, because the TENS also going to work on your mechanoreceptors. So if the simple TENS which applied on your skin will help you decrease the pain and will help you to decrease the muscle spasm, it means your mechanoreceptors working are good. So whenever you just think about the soft tissue mobilization, so first think about the soft tissue mobilization. Don't think about the mechanoreceptors. Don't go about the stretch. See, stretching is not a soft tissue mobilization. Stretching is the second part or second step after the soft tissue mobilization. Okay, so thank you everyone, and thank you HCAP for this opportunity. I have a very short interval to be ready for these lectures because of some medical emergency in my family. But things are good right now, and I'm just allowing the next resource person to talk with the new techniques of physiotherapy. And I can say students who did work for HCAP for this youth Webicon, they are doing a good job. And all the participants who heard me, please continue your job for next 30th April, and every day from between 11 to 1. And let's try to add on something in our treatment, and let's work on the other things. Okay, thank you. Bye everyone, and thank you HCAP and thank you Dr. Akim Budgil and the team of HCAP. Bye.